Hi, it's Dr. Maria Rodriguez here, and today I want to talk to you about oral health. I'm not sure you all are aware, but the health starts in your mouth, and there is a very well-known dentist. He's known as the dentist to the stars, and his name is Dr. Jerry Curatola, and he has some fabulous work done on cavitations. I'm not sure if you all know what cavitations are, but when you remove a molar or a wisdom tooth, there's a hole that ends up in your jaw. And the goal is for your body to fill in that hole. However, 80% of the time, it does not get filled, and that's called a cavitation. Now what happens? That hole is like a nice, dark, warm, moist cave. And you know what likes that? Lyme spirochetes, other toxins, other bacteria, other viruses. And so you could be having this low-grade inflammation due to that infection going on in your jaw, and you're not going to know it because many times, most of the times, there are no symptoms. You could get other systemic symptoms that you would never imagine are related to these cavitations. So when you get a tooth extracted, removed, you want to give it at least a year and follow up with your dentist to make sure that a cavitation is not formed. If after a year it's good and it closed up like it should have, then you could give it another 5 years and you recheck it then. Now, not all dentists know what these cavitations are, so you might have a little bit of a struggle with your dentist because you're not going to feel good when you make him look bad that he doesn't know what a cavitation is. So you want to approach your dentist carefully, and if they don't know about it, then you might want to ask them to refer you. So there's a special x-ray called a cone beam that you need to take in order for these cavitations to be detected. It could also be detected with a lot of dentists now have a CT scan of just the mouth. However, CT scans have high radiation, so if they could do the cone beam instead, that would be great. Now, if they did detect a cavitation, there's special dentists that would remove the cavitation, and there's a special way to do it. So this is what you want to ask. They need to do it with a laser, and they need to apply ozone into that hole because that's going to clean it out and it's going to stimulate bone growth. Apart from that, you need to do something that's called let me look at my notes, platelet-rich fibrin. What is this? It's taken from your own blood and inserted in here, wherever you have the cavitation, in order for that hole to get filled, and that's very important. So you want laser, and I think there's a special name for the laser. I think it's called biolaser. You want the ozone, and you want the PRF, which is the platelet-rich fibrin. Also, Dr. Curatola has his own toothpaste. What is the problem with toothpaste? A lot of chemicals, fluoride has been shown to be bad for us, and they still continue to be fluoride in our toothpaste. And even the healthy toothpaste are a little bit too harsh for the good bacteria in our mouth. So just like in our gut we have good and bad bacteria, we have the same thing in our mouth. And so they need to be kept in a balance. So if you're using products with tea tree oil or other essential oils that kill the bacteria, that's not necessarily good because we need to have a good balance. The same thing with pretty much all the mouthwashes is that they get our mouth out of balance with the good and the bad bacteria. Also, you can find Dr. Curatola's toothpaste. I just looked it up on Amazon, and it's called Revitin, R-E-V-I-T-I-N. And you can also get his book, The Mouth-Body Connection, if you want more information, or you can contact my office at 305-883-5577, and I'll be glad to help you with any question that you may have. Have a beautiful day.